And our next guest says there should be watchdogs who make sure that patients don't get overcharged. Steve Kelly is co-founder and CEO of ELAP Services, and according to its website, ELAP's mission is to recognize a medical provider's actual cost in delivering services and allow a fair margin above that cost. Steve Kelly, we welcome you now to America's Forum.
Thanks. Good afternoon.
It is good to have you Skyping in, sir. So this is a switch. I thought that one of the big Obamacare concerns was that doctors and hospital fees were being cut. So you say really there's a possibility that patients could get gouged with the prices?
No question. I don't know that our client base is largely self-insured employers, 100 to 1,000 employees. These would be public entities, public school districts. And our advice to them is to not really wait or have their expectations raised by the Affordable Care Act, but rather to take a hands-on approach to managing the cost of treatment. And there is a way to look and understand what the actual cost of a service is, to make sure it's a rational amount that's being charged and to pay a rational amount. So I don't think we advise our clients, who are these self-insured employers, not to look for the Affordable Care Act to provide relief, but to take the situation into their own hands and use the same business disciplines they use in other areas of their enterprise and just apply that to healthcare.
Steve, could you give us an example of where these business clients of yours need to really be smart shoppers, what they need to be looking out for? Is there a certain medical procedure or some other loophole in Obamacare that will allow patients and businesses to be ripped off?
Well, it's not so much, I don't know that it's so much Obamacare. There are plenty of problems with the act, and I don't think that employers can be, as I say, be optimistic it's going to bring any immediate relief. But let's take an example. Let's look at a CAT scan, for example, which is a very routine treatment performed on thousands of times a day in hospitals across the country. The average hospital's cost to provide a CAT scan will range somewhere between $200 and $400. That's fairly consistent depending on the CAT scan. The level of complexity. But the bill charges for that same procedure might be $4,000 to $6,000. The insurance mechanism obscures the actual cost of the service and just provides a lot of confusion so that an employer really can't get their arms around what is a reasonable amount to be paid. I don't think there's anything in the Affordable Care Act or in the insurance mechanism even before the Affordable Care Act that helps employers with that kind of confusion. So our advice to employers is to simply establish rational limits of reimbursement in terms of what they're going to pay for a procedure and install that in their own plan document. I don't think that that's going to be coming from the Affordable Care Act, and I don't really think the Affordable Care Act addresses it directly.
So it sounds almost, from my days in Congress, we had an endless parade of physicians coming in talking about what they would be paid, wanting to see that raised, and every year it seems that would go up. But it sounds like your business and others really are able to go to small business, go to the private sector and say, look, here's what the cost should be. You negotiate your own fee structure. Now, Steve, my question is this, because Obamacare seems to have government written on it from soup to nuts, the heavy hand of government taking over so much of this. Do you ever expect activism on Capitol Hill or in the legislation or in the regulation that would set up a federally sanctioned watchdog as part of the bureaucracy, or will companies like yours, ELAP, continue to have free reign in the private sector to offer these services?
Well, I'm gonna advocate for companies like mine, of course. I think there always will be, I hope that the law is not going to infringe upon an employer's right, and I would say obligation, to watch out for what's being spent on their employees' behalf. And our experience is that if an employer can get to the table with a local healthcare provider, can begin to have dialogue, direct dialogue with local community-based providers, good things happen. When employers and medical providers sit at a table and have discussions about the cost of care, invariably, we find it has a very, very positive effect. So we're big advocates for that. Employers can manage costs in every area of their enterprise. Without fail, they're very good at containing costs, with the exception of healthcare. And I think a lot of that is because the employer community has abdicated that to the insurance community with very poor results. And I don't have much of the Obamacare discussion is just about insurance regulation. And if you do what you always did, you'll get what you always got. And I think we're in store for more of that. The renewals that we're seeing for some of the plans, they're beginning to escalate again. The increases in terms of trend and renewal prices are beginning to go up again. And I don't think there's anything in the law or the insuring process that's going to change that. So we're big advocates for employers taking a market-based approach and just using their basic business acumen to sit at a table with a local provider and carve out deals that'll work for their employees and for the local provider as well.
Well, Steve Kelly, it sounds like when the shoe is on the other foot, we often hear the saying in the medical profession, physician, heal thyself. Sounds like your business is saying, businessman and businesswoman, don't forget business principles when sitting down to deal with health care. We wish you well. We thanks for the insights as you're the co-founder and CEO of ELAP Services. And I imagine you're going to be pretty busy in the days ahead given all the changes to health care. Thanks so much for your time.
Thank you.
Steve Kelly of ELAP Services. We're coming right back.